Good morning, everybody. BTL globally. We are all very, very blessed to be here, and I'm very happy to really be hosting this webinar, Mastering Medical Weight Loss. We're talking about this a lot in the United States. For all the people that are tuning in from across the globe, really, this is some great information from you, coming from some of the best minds in the industry across the U.S. We have Dr. Silva. She's a family medicine doctor out of Chula Vista, California. We have Dr. Rappaport, internal medicine doctor out of Jacksonville, Florida. Dr. Palm, dermatologist out of Solana Beach, California. Dr. Eskra, plastic surgeon out of Kunston, North Carolina. And my name is Nick Tverdik. I'm owner and wellness director at ARIA Integrative Health in Denver, Colorado. We have a full functional integrative health center at ARIA, but also the full med spa side as well. And the medical weight loss world is really taking the entire industry by storm. So when I say that, we are getting a lot of interest into this entire world, right? So when we're going through this entire process, we're actually going to be talking about some of the things that have not been discussed as much as it really should. And we're going to go through several different patient examples with this, different case studies that we have. Before we dive into that, I want to talk a little bit about BTL and why we love them so much. We own every single device that BTL makes, mainly because they work, right? Efficacy is the number one piece to bring any sort of equipment into your clinic, but it's the functional piece that really gets me excited. When I can sit down with a patient and it's not just all about the aesthetics anymore, it's really solving some of the root problems that are happening, especially in the entire medical weight loss. There's a lot of problems that are happening along with this that not many people are discussing. And what's so beautiful about BTL is it's actually a solution. And we're going to get into all of that as we go through this webinar. So when we do this, BTL has numerous different technologies. Yes, the M-Sculpt Neo is permanently destroying more fat over a larger area than anything that exists. Yes, it's the only option in the world that can permanently destroy visceral fat, which we're also going to be discussing as we go through this. But as importantly, we're solving a muscle problem that affects so many people. We're building more muscle in a shorter period of time with this device than anything that exists out there. And the same thing goes for M-Face, is really addressing the true root cause of what's happening with facial aging, but also what has really been sped up with the entire medical weight loss conversation. Because we're not just losing fat, we're also seeing a lot of aesthetic changes that are happening with faces falling. So what can we do to really combat that? We're going to be diving into all of those issues as we go through this process. So now we're going to talk a little bit about what's scary. And anybody that lives in the United States, they can look to the right, they can look to their left, and they see that we have an obesity problem. We are the #1 most obese industrial country in the world. That is crazy, right? It's sad, in my personal opinion, that we are so successful in so many things in the United States, but we have a major, major problem. And some of the medical weight loss is starting to solve it, right? But we have major, major issues in this country that need to be addressed. And we're going to get into some of the science, what's happening, what are these GLP-1s really doing to help solve this whole thing. We are top 10 most obese countries in the world overall, and 19 US states have an adult obesity rate that exceeds 35%. That is sad, especially on the functional medicine side of things. We do a lot of bioidentical hormones. We really want to get to the root cause of what's happening with our patients while we're combining it with the aesthetics piece. But this isn't changing. It's not going anywhere. The obesity epidemic is actually growing. It's not getting better. So having a solution, both on the medical weight loss side, as well as what we can do to combat that. So the importance of controlling obesity. That's what the GLP-1 whole conversation is really like. But what happens if you don't do that? So you're 2.5 times more likely to develop heart disease. So we know that cardiovascular disease is a major problem as well, but a lot of times it's stemming from what's happening with your insulin resistance processes, right? So when you have that and we're not addressing the obesity piece, you are much more likely to develop heart disease if you're not taking a look at solving that core problem. You have a 65% higher risk of developing Alzheimer's. And I know a lot of countries actually don't even call Alzheimer's. It's known as type 3 diabetes, right? So if we are not having this conversation about what's happening with obesity and the cascading problems that are occurring with this entire process, it's not just being overweight. It's not just the cardiovascular disease. It also stems to the entire system, and that includes the brain and cognitive capabilities. So you have a 39% greater risk of developing dementia. This is real, and it should be really, it's scary for me just to see the trends in what is happening. But what's also exciting is there's some solutions to really get to the root of all this. Amazing people on this panel are really going to dive into that whole process. So I'm going to tee up Dr. Silva. I'm blessed to know her. I've spoke with her a couple of times now, but she's going to dive into how does this work? How is this GLP-1 antagonist actually starting to solve this weight loss process through injection? So Dr. Silva.
Hi, Nick. I'm so happy to be part of this conversation that's really going to revolutionize how we treat obesity in this country. Semaglutide works by mimicking the action of GLP-1, glucagon-like peptide 1, which is a natural occurring hormone that helps to regulate blood sugar levels. And so it stimulates insulin secretion and lowers glucagon secretion when blood glucose levels are high. Why this is so important in my practice, I treat a lot of women and men who are going through hormonal changes. As we age, the insulin becomes more sluggish, becomes resistant. So having a substance of medicine that actually makes the insulin more sensitive and helps the glucose be more efficient is a game changer for my patient population. I've had patients who told me that dieting has been challenging until this substance. And what I like to tell patients is how it works so that they can understand and hopefully mitigate the side effects. So for example, the semaglutide also causes gastric emptying to slow down. So when patients understand that, they can understand that one of the most common side effects, which is nausea, will actually can be mitigated if they eat mindfully, meaning eat slower, and they don't eat as much. So patient education is really important when they understand how the semaglutide works. And I love that it helps people reduce their hunger, increase feelings of fullness because they're full faster and they stay full longer. And that's what leads to reduced intake. What I like to tell my patients is that whatever you eat, you're going to eat less. So you're going to lose weight on it. But why not take this chance to change your habits and eat things that you know are going to help you maintain the weight loss? And that's what I try to focus on for my patients.
Nice. That's excellent. And this is a big deal in the education of your patients, because everybody thinks this is just a miracle piece, right? I'm going to take these injections, all the weight's going to fly off. There's no negative repercussions that could possibly happen with this because everybody and their mom is doing a GLP-1 antagonist right now. And it's really, really important that we're seeing in our clinic to really educate the importance of this is what's going to happen, expect this to happen. And then it's having a conversation of, okay, so what can we do to mitigate some of those negative side effects? So to go a little bit further, having protein is really, really important. If you can do that, it's going to help with that muscle piece as well. So when you're getting into the medical weight loss injections, having the conversations with your patients is really, really important. And if you're not having that, and I know some clinics, there's a lot of fly-by-night clinics out there that aren't, in my opinion, are not doing this right. I know of a couple clinics that aren't even doing blood work, initial blood work, and getting patients started on this. There's some scary. Go ahead, Dr.
And I
Silva.
will tell you that because we're also introducing tirzepatide, patients that do have side effects, they will have less side effects with the tirzepatide. So I have switched people off of semaglutide to tirzepatide. I also do something called microdosing, where I don't use as much as they will do in other clinics, and that will also mitigate side effects. I think in a lot of weight loss clinics, they've been giving a protocol where month 1 you do this, month 2 you do this, and increasing just arbitrarily patients on these medications. But 1, it's not necessary, and 2, it's really not safe. You really need to discuss what the patient journey is, and you will notice most of my patients don't even ever get to the highest dose. Most of them are mid-level. They don't have the side effects. So I think it's important for people to really understand that we should do this responsibly and not just tier people up higher just because we can. We really need to have that conversation with the patient, because they're going to have a better experience and they're going to be able to maintain the weight loss and just feel better and really empower them to take control of their health.
Yeah, absolutely. And that brings up a good point, is some of the things that are happening, obviously, with the negative side effects from semaglutide that you were talking about. And we're seeing many fewer overall side effects that patients are noticing with the tirzepatide, but these are all very real side effects that are happening. So educating and doing this appropriately is very, very big deal. Sometimes, and when we're talking to doctors, so I travel and speak quite a bit, and Dr. Nanda actually educated me on this. A lot of people are forcing the dose higher because the patient might not be losing right away. And what's happening that he really educated me on is actually correcting some of the insulin resistance first before the weight starts to drop off. So having that conversation, if somebody is on this for 3 weeks, 4 weeks, they're not seeing any weight loss, having the conversation is we're solving the core root issue first before we dive into this. But having these very real side effects conversation with your patients, I cannot stress enough. So Dr. Rappaport, I want to tee you up on this because this is really, really important. And I jump on TV and I advertise and talk about medical weight loss and Emsculpt Neo and M-Face. And when I say this, when there's people in the audience there, their jaws are dropped because this is not a conversation that people like having.
Right. So these GLP-1 inhibitors, they've been out for a number of years, and we have multiple literature reviews and we have clinical studies that show great weight loss, but they also show that we're losing more than just fat. And the primary concern is that from that total weight reduction that our patients have, up to 50% of that is actually lean body mass. And the key with lean body mass is reduction in that means a reduction in your skeletal muscle mass. And skeletal muscles are very important for 2 primary reasons. One, skeletal muscles are the primary site of glucose disposal. So our muscles need glucose to function. The lower our skeletal muscle mass, the worse our glucose control is. And the second really important feature of skeletal muscles is that they're a strong determinant of our metabolic, our resting metabolic rate. So the lower our muscle mass, the lower the resting metabolic weight, the more likely our patients are to regain weight and cause all that yo-yo dieting that we hear about. So in addition to those 2 features, physically, the patients are going to start noticing decreased muscle strength, as you can see on the graphic, decrease in physical performance, problems with mobility, impaired balance, which leads to falls, which we're always concerned about in our elderly patients. And then, of course, undesired changes in appearance. So we talk about the Ozempic face, the pancake butt, when our muscles start to waste away along with the fat loss. So we need to keep this in mind when we counsel our patients. But another subset of patients, I just want to throw this in here. It's very interesting. The data that we've collected with this 40 to 50% weight loss reduction, muscle reduction, we also see that in our bariatric patients. So the first year post-op with our bariatric patients, they are losing weight, but they're also losing a significant amount of skeletal muscle mass. And it's also true for our patients that do weight-related diets. So our Weight Watcher patients, our Noom patients, our intermittent fasting patients, they are also losing skeletal muscle mass. So we need to keep that in mind when we're taking a history and physical from the patient, and to make sure we counsel them that this is a very real side effect of weight loss.
Yeah,
Barbara, Nick, and Dr. Silva, I would love to ask you a question as the resident dermatologist on the panel. Actually, Dr. Silva and I share quite a few patients. When I have people that are struggling with weight loss or hormonal changes around perimenopause, she's been so helpful in our efforts, with supporting them and helping to achieve some of their fitness goals. And one question I have, because our population here in San Diego tends to be quite fit, we're a wonderful temperament and temperature. So, there's, I think, a high priority put on this. So my curiosity is, have they really dug down into some of this data? And are these people that are losing higher amounts of muscle, people that are sedentary and have larger weight gain? I'm curious, for someone that comes in and needs to lose 10 to 15 pounds, has the perimenopausal weight centered around their abdomen, they're working out 5 days a week, they're doing weight training 3 times a week. Is some of that muscle loss mitigated if they're already doing dietary things and activity-wise to preserve muscle?
It's very interesting because people really don't take enough protein, and we're talking about nutrient dense protein. We're not just talking about taking a protein shake or taking a protein bar, but it's really important to make sure that you're taking adequate protein that will be able to sustain your fitness level as well as to preserve your muscle, because sarcopenia will happen 1 to 2% loss of muscle mass just with aging. So then if you add on this rapid weight loss, the fat comes off so fast, and then you lose muscle at a rate faster than it can get built back up. So making sure you're doing weight training and resistance training along with the dietary changes. And that's why Emsculpt Neo and the Emsella is great, because people that can't get enough exercise, this strengthens their core muscles and their pelvic muscles so that they can feel stronger and then do the exercise necessary to actually build muscle. So you have to make sure you're taking enough proteins and amino acids pre-workout and then post-workout. I tell people, make sure you're taking at least 30 grams of protein after you work out, within 30 minutes of working out. And that's going to help mitigate that. And nobody likes to talk about, I saw that Nick just brought this in, so this is a very nice segue, that muscle loss is not only losing muscles in your biceps and buttocks. Your pelvic floor consists of muscles, just like any other muscles in your body. And so it also loses mass and strength over time, which can cause weakness and your pelvic muscles to be tired and saggy, which will lead to incontinence, the loss of bladder and bowel control, sexual function, painful sex even, and then balance and posture. People don't really understand what I tell my patients and what I love to tell my patients. And we're lucky in San Diego that we can be active and people are out there. But mobility is independence. And people don't understand, if you don't have a good core, if you don't have that strength, you're more likely to fall. And there's a lot of people that when they fall, and you've seen them in the nursing home, 50% of them will die within 1 year if they have a hip fracture. So it's really important to make sure that we understand that the muscles that we preserve will help us with balance and mobility, which is so important to me, being a longevity doctor, because I want people to stay strong. I want people to be able to be active and to be able to really enjoy their life and do the things that they want to do. It's very interesting. There was a study out of some cardiology research recently that showed that there's some diuretic effects of the GLP-1 inhibitors, where they saw that patients that had heart failure, they had less IV diuresis that was needed as well when they instituted semaglutide, which I thought was very interesting. So we think about all of these things because we can't forget the other effects that it can have on our body. So because I am a longevity, holistic, integrative doctor, I'm looking at everybody from top to bottom, and I'm looking at how people are being able to not only lose the weight, but maintain the weight. Yeah. People are not going to be interested in a diet. And I tell people come to see me and they say, I'm afraid to be on this because of the side effects that I've heard, and I don't want to lose my muscle. You're exactly right, Dr. Palm. Patients that need to lose only 10 to 15 pounds, their treatment protocol is totally different. I will just do microdosing on them, and we may not even do it once a week. We may do it once every 2 weeks, and they just need enough. They want that just to feel the satiety and to feel full. So you don't have to follow. You have to remember that these medications were given for diabetics to treat them with insulin resistance. Mm-hmm. They took the same dosage and gave it to non-diabetics, which I think is not really applicable to many of the non-diabetics. And that's why there are people who are suffering from side effects. So I tell people, remember, as clinicians, we have to look at the patient in front of us and really do customized, personalized care. I feel nervous about people going to weight loss clinics where they're just arbitrarily increasing people and following a tier system, which really is not healthy.
It's scary. I know I've used that word multiple times in this webinar, but it's so refreshing to hear doctors out there such as Dr. Silva really taking the time to go through everything that can possibly happen, because we've seen patients come in that experienced incontinence, both fecal and urinary, from GLP-1s at other clinics, and they didn't have any conversation around that. And then all of a sudden, this is affecting their quality of life. And now when they come in, you're like, we have a solution for this process, and we can actually guide you down the most efficacious and safe way to do that. And it's the skeletal muscle mass piece is crucial for longevity. It is the most important conversation that we should be having, but that's not all that's really occurring with this. I know we've talked about core and pelvic floor and some of that, but it's also affecting the face. So Dr. Palm, could you please talk to us about really some of how this is affecting the face and what you're seeing?
Yeah, I mean, I think there's a lot said of Ozempic face. I think that was mentioned by one of the prior speakers. And so when we have rapid weight loss, I sometimes see this even with pregnancy, where there's large changes of weight, and then postpartum, women complain that, boy, my face is deflated. And really our reserve and sort of where we hold weight in our face is related to some of the deep fat compartments that are in our skin, or that are in our face. So the mid face, there's a deep cheek fat pad that sits more medially. And then we have one called our SOOF that sits here, and we've got some deep fat pads that sit in our buccal cheeks. And so as we lose weight rapidly, especially over 40, I think Catherine Deneuve is famous for saying after 40, it's either the face or the fanny. And so, if you have a little bit of weight on you, you do look a little more youthful because you're maintaining some of those deep fat pads. But with continued weight loss, and if it's more rapid, if you're on a weight loss regimen, if you're on one of these GLP-1s, or you have a sudden weight change because of physiological changes with your body, we start to notice this very rapidly because of deep fat pad loss. And this is really some of the structural support. And as that happens, we start to see telltale signs on the face. And what I tell patients is, a sign of youthful skin and a youthful face is not only an even tone, but it's a lack of demarcation between cosmetic units in the face. And so when we start to lose weight, we start to see these lines of demarcation, such as the infraorbital hollows, starting to see the nasojugal folds, deepening of the nasolabial folds. There may be some changes along the jawline because of sort of loss of buccal cheek fat pad or descent of the jowl fat pad. And we start to see some of these characteristic lines that happen not only with aging, but we also can see this prematurely if weight loss is rapid.
Yeah, we're seeing this. And by the way, if any of you are doing this out there and you're not having these conversations with your patients and or having a solution to really address this, trust me, your patients are Googling. They're seeing these pictures. They're seeing Ozempic butt. They're seeing Ozempic face. If you're not getting ahead of that conversation and waiting till it happens, in my opinion, you're kind of missing out on not only really educating your patient to guide them down this pathway appropriately, but then also there's a lot of opportunity for you in the business, but then also on the health side of your patients. I mean, muscle building and addressing that entire process is such an enormous business model out there, but we can help so many people, kind of like what Dr. Silva was just talking about, and Dr. Rappaport. Skeletal muscle mass is the key to longevity and overall health. That's how we're utilizing insulin that we're producing. So this entire process that's getting broken down, if we're not addressing it and looking at what you can do to help these patients, you're kind of missing the entire point. But muscle building, if that's the key towards all longevity and long-term health, and you're not having conversations with your patients about that, you're kind of missing the entire process. This is huge data points, right? So right now, 5.7 million people were prescribed semaglutide in 2023. That has gone skyrocket already in 2024. That is a huge, huge piece of the pie that people are not having these conversations with them about. And if you have a BTL device, because remember, this is a physiotherapy and cardiology company. It just happens to have the aesthetic side that is focused so much in this country, but we are getting to the root cause of so many issues that we can actually address with these technologies. I absolutely love it, but there is so much opportunity out there to really combine both Emsculpt Neo, M-Face, and having these functional conversations of proper protein intake. We were just at the BioT event over the last weekend, and they really spent a lot of time talking about the forms and the diets around it. So this is not just an isolated conversation. Everybody's talking about it. Making sure you're doing it appropriately is a really, really big thing to do. So how do you optimize muscle loss? So I think it's really, how do you have a conversation with your patients about this could happen if you're going down this pathway? What do we really need to do to talk about exercise? Yes, of course. Proper protein intake and diet? Yes, of course. Well, what can we do with technology now to ramp that up to a level that we cannot do ourselves? And that's where BTL really comes into play. So a little bit of background about us. We have that Functional Integrative Health Center in Denver, but we're actually the #1 BTL utilization clinic in the 24-state central region. So we do a lot of treatments with Emsculpt Neo. We're one of the top providers in the country. We do a significant amount of M-Cell. I absolutely love that device, and one of the top M-Face providers. When you are having a conversation about some of the issues that your patients are already talking about and searching for and Googling themselves, it brings so much more credibility to you, because so many people are out there just selling the benefits. Okay, well, this is most likely going to happen based on the data. Let's have a real conversation of what we can do to manage this and really amplify your health coming out the backside. And that could be some of the microdosing. And I know we're getting some questions in the chat, and we're going to come to that at the end, where we can actually talk about some dosing of the microdosing, et cetera, things like that, and when to combine these technologies. And those are the conversations that I get really excited about, because I'm a big believer in a rising tide lifts all ships. And we figured out quite a few things in our clinic. And I know Dr. Silva has Dr. Rappaport, Sclerotherapy, as well as Palm. So we want to share, and we want to really help you have a better piece of this entire craze that's happening. So let's talk about Emsculpt Neo, because it's my favorite device, just because it can do so many different things. But Dr. Rappaport, could you really talk about what Emsculpt Neo is?
I am happy to talk about Emsculpt Neo. It is my favorite BTL device. We use it every day in the office. I initially brought it in as an aesthetic device, but I quickly learned the huge functional benefits that it offers to patients. So Emsculpt Neo is a unique device, and it works with two different energy modalities. It works with radio frequency energy, and it has high fem technology. As you can see on the graphic here, both of them work in a synchronized fashion. The radio frequency is going to cause apoptosis of the nucleus in your fat cells, going to break down the fat cells over time and clear them out of your system. The high fem magnet basically induces what we call, and what BTL likes to coin, supramaximal contractions. So these are contractions that you individually cannot achieve on your own. And the little phrase that we say is, in 30 minutes, you get 20,000 crunches when we're treating the abs. We're also looking at about a 30% loss in fat and a 25% improvement in muscle mass. And that's exactly what I was mentioning earlier, the concern with skeletal muscle loss, and how can we help our patients regain what they've lost or build up their muscle before they start on their weight loss journey. So Emsculpt Neo does this beautifully. There's no pain, there's no downtime. I just recommend my patients come in well hydrated before they get started, but it's a really simple, easy treatment that everybody can incorporate in their day-to-day routine.
I love that.
Yep. And if I can, Nick, I'm sorry, if I could just make one other comment. So when I got my device, it was approved for just 5 body parts. And I love the fact now that we can treat pretty much the entire body. And you can see it's highlighted here in the figure. But what's key when we were talking about skeletal muscle loss, what are our largest muscle groups? So the glutes, number 1, which Emsculpt Neo can treat. Your quads, number 2, which also Emsculpt Neo can treat, and your hamstrings, number 3, which also Emsculpt Neo can treat. So you can really target all of those areas and help your patients improve any potential skeletal muscle loss.
That is huge. Could you give us a case study on really what you've seen internally in your clinic with this entire
yes, sure.
this entire space? So let's actually get to that. So before that, because you just talked about the main big muscle groups,
yes,
that really dives into the balance piece and stability. 80% of all back pain is core pelvic floor stability, right?
Exactly. So we have to remember that our core is more than just our abdominal muscles. Our core is like a cylinder that encases the bottom half of our body. So our abs create part of that core. Our back muscles, the lats, they create part of it, your hip adductors, and your pelvic floor. If you put all 4 of those areas together, you're basically creating a cylinder, and that helps protect your internal organs. And it also helps with your mobility, with day-to-day functioning. So all of those need to be nice and tight and strong for ultimate health gains. So with BTL, we have the Emsculpt Neo that can help with the entire abdominal area, including our oblique muscles. And then we have the Emsella chair that, of course, will help with the pelvic floor. But the case here in front of you is one of my very dear patients. She's a fabulous 51-year-old. She was a late first-time mom. She had her baby around 40, and after that gained a significant amount of weight. She was an athlete in her younger days. She was a gymnast. She cheered for FSU, actually. She ran the New York City Marathon multiple times. But after the baby, the weight just seemed to pile on, and she couldn't get it off. And she was starting to develop back pain, hip pain, knee pain. She couldn't play tennis anymore, pickleball. She couldn't run at all. And she was thinking of maybe going to see one of the plastic surgeons here in Jacksonville for what we call a mommy makeover. But after she realized what all was involved with the mommy makeover, she thought, let me see if there's a non-invasive way I can maybe start this journey to better health. So she came in, and we had a frank, long discussion, and we put together a plan where she would receive Emsculpt Neo treatments on her abs and her the edge applicators for her flanks. And then we would also start semaglutide. And I always like to start low. And then we judge how rapidly we increase the dose based on patient's weight loss, side effects, that sort of thing. And she really didn't, she eventually went up to the 2.4 milligrams, but then we've been bringing her back down again. And in the 6 months, so she did Neo 6 months ago, she's been on the semaglutide monthly. Her initial BMI was 30, so she was the perfect candidate to start these GLP-1 agonists. And over this time, she's lost 40 pounds. She's lost 4 inches around her waist. Her BMI has dropped from 30 to 23. She's dropped 2 dress sizes. But for her, the most important thing, and I literally saw her yesterday, she is back out on the tennis courts. She played 3 hours of tennis this weekend. No aches, no pains, her hips, her knees, back, everything felt great. And she is just thrilled with her results. So we have her now on just maintenance dosing of semaglutide. And I wanted to show you these pictures. First of all, because they're phenomenal before and after pictures. But secondly, a lot of our patients that lose weight rapidly develop that crepey loose skin, especially on the abdomen. But I want you to see that she did not develop that despite 40 pounds of weight, and she carried all of her weight in her belly. So doing the Neo at the same time as starting the semaglutide, we avoided all of that crepey skin, and she's just thrilled. She's actually sent a lot of patients to our office. She's so happy with the results.
I bet these results are phenomenal. And this picture right here, for everybody that's watching, this is what it's all about. This is her quality of life and how much more confidence she has in herself and the ability to do things outside of the function, right? Because I'm sure what drove her to see you to begin with, it wasn't the knee pain, it wasn't the joint pain, it wasn't the back pain. It was, I don't feel comfortable in a bathing suit. I don't feel comfortable wearing my tennis skirts. I want to be back out there.
Exactly.
So being able to really have that whole conversation, that's what this entire process.
And it's also important, I think, to set realistic expectations. We want to do the healthiest thing for our patients and the safest thing for our patients. And I tell all of my patients, we're going to do this low and slow. Your weight did not come on in 1 month. Your weight has been, climbing up over the last few years, and it's going to take time to slowly get that weight off and for you to be able to maintain the weight loss. And then I presented them what I feel is the best plan for them. And the vast majority are really appreciative of the conversation, and they're all really interested in incorporating Emsculpt Neo into their weight loss routine.
Absolutely. And it's not just Emsculpt Neo into this whole weight loss routine, because like what Dr. Palm was talking about a little bit earlier, it's also what's happening in the face and having that conversation. So Dr. Palm, would you talk about what is M-Face and how that really goes into this conversation?
I feel like the hair club president. I'm not only the president, but I'm also a patient. So this is, I think has become just absolutely my favorite device of 2023 going into 2024. We were fortunate enough to be the first clinic here in San Diego to have M-Face. And, we've now had it about 1.5 years and just have had incredible results. And it has really been, I think, whether it's a weight loss patient or just somebody fighting gravity, it has been one of my favorite procedures to pair with some of the injectables that we do, whether that's, weight loss, volume that we're supporting, or just aging, natural changes that happen with facial aging and volumetric changes on the face. And so I explain to patients, this is slightly different technology. We're still hitting some of the same 2 buckets as something like Emsculpt Neo, but we're using synchronized radio frequency along with a little different technology for causing involuntary contraction of the muscles. So instead of high FEM, which is electromagnetic energy, in this case, we're using high intensity focused electrical stimulation. It's not a painful procedure. We probably have people on the call that haven't experienced it. I explain to patients that it kind of feels like just sort of like a caterpillar is contracting on your forehead if you're having frontalis treatment. On the cheeks, it's just involuntary contraction of these 3 different muscles that we're targeting in the mid-face. But the studies indicate that we're building muscle mass in these 4 targeted muscles, the frontalis, the 2 zygomaticus muscles, major and minor, and the risorius muscle. And I explain to patients, particularly in the mid-face, that these 3 muscles really act as the hammock that holds in some of this deep tissue you these deep fat pads that I was talking about. And it has a remarkable change through the treatments. All the clinical studies were based off of 4 treatments. For my younger patients, we're still recommending a series of 4 treatments, typically about weekly. But for many of my patients about 50 and over, or if they have significant laxity on the face, we choose to do a series of 6 treatments, and are really seeing remarkable changes in terms of change in sort of the OG curve, so that beautiful S sweep in the face, depth of the nasolabial fold, improvement in the jawline, including the jowl formation, and just restoring some of the vectors of the face, particularly in female faces. With some of the non-surgical work that we do, we never want to bulk the face. And so I think this is something I really love to pair with some of the upper face and mid face injectable work that I do to help fight some of the gravitational changes and just natural age-related changes that are happening in the skin. Just in the last few months, we now have a submental applicator. And so many of our original M-face patients have been waiting with bated breath to also introduce this technology. What's nice about this technology, in the forehead and in the midface, we are not affecting fat. We're not using a temperature that causes adipocytolysis, so loss of fat cells. But in the submentum, if appropriate, we can tune the radio frequency to help reduce fat and cause that fat destruction in the preplatismal fat that's actually in the submental area. So really, now we have a full way through 3 different areas to affect muscle tone. And in the submental area, we're affecting the digastric muscles. So just, really sort of sharpening that jawline and helping with the double chin region.
Yeah, we've seen amazing results. I mean, we got it as soon as we possibly could bring in M-face, we did. And we're actually top 10 in the country. Somebody just texted me is in both M-face and M-Sculpt Neo, and patients absolutely love this. And the actual natural volume that is produced through this and the lifting in the submentum area, this is a complete game changer for treating that submentum area. So it's wonderful to hear from a dermatologist really in this whole space. Jumping back a little bit to a case study of what you have seen with this, could you talk about one of your patients that is perfect segue into that conversation?
Yeah, and I think we have, I just saw a patient yesterday, not on semaglutide, but just a beautiful patient. She's actually a physician in her 40s, and she's been a long-time injectable patient, very modestly done. I see her a couple times a year, and she just really wanted to get sort of that sculpted look and just remarkable changes. I think the best aesthetic work is done when people just look like their best version of themselves, and they authentically look like themselves. We're not sort of manufacturing an unusual or unnatural effect. And I think I love technologies, whether it's injectables or devices, where we're more in the lane of being regenerative. So this idea that we're building muscle back and helping to sort of restore certain tissue planes is very attractive. I'm have the luxury of sitting on the medical advisory board of BTL. And so along with this illustrious panel, sit with a lot of wonderful plastic surgeons and surgeons. And so many of them really tout this as almost being like physical therapy prior to rhytidectomies and then sort of maintenance treatment afterwards. But if surgery is just not something that is an aesthetic goal or not appropriate for the patient, I think this can be so helpful for patients for just restoring something non-surgically. We've just never had a technology to target muscle and build muscle mass. And so this is a patient of mine that actually has been on semaglutide. When she came to us in the initial photo, she actually had lost 15 pounds already. In her after photo, she's lost a total of 30 pounds. And so we did a series of 6 treatments. And what you see is, definition sort of returning to the face. And despite a significant weight loss that normally I would see very cachectic changes on the face, we've been able to restore natural convexities to the face. So her mid face, we've maintained some of that facial volume by actually strengthening those muscle groups. And then you see jawline definition without pronounced jowl formation, which we sometimes see in patients that have rapidly lost weight. And so again, I think she is someone that, I know there was a question in the box about how do we pair some of these other devices, technologies to restore facial volume. Do we wait until people have achieved their weight loss goals, or do we do therapies along the way? Generally speaking, I tend to be a little more conservative if people are rapidly and dynamically through a weight change. But M-Face is one of those things that I actually like to be a little proactive about. That and some of the collagen stimulators we use in the injectable space, I will, go full force in with M-Face. With some of the collagen stimulators globally, I'll address some of the changes that I know are going to happen in the skin envelope. And it's really important that we're cognizant about what layers we're placing these. I think that's, a very hot topic on social media right now. But I think, slow and steady and doing something like M-Face while they're dynamically going through weight loss really helps support some of this muscle changes and possible sarcopenia that some patients through rapid weight loss suffer from.
That jawline is amazing that M-Face was able to bring back for her, because we're seeing some pretty crazy falling and hanging, and when you can really restore all that connective tissue to see that lifting, and you can see some nice volume restoration as well in her cheeks, that is excellent. Now, when people are losing weight, sometimes it can be pretty dramatic in the body side as well. And I love that we have Dr. Eskra here to talk on the plastic surgery side, because that's happened where somebody comes in, loses massive amounts of weight, and they have some skin elasticity. How have you seen your patients that have done the semaglutide or tirzepatide in your clinic? Could you give us a case study, please?
Yes, sir. Thanks, Nick. So, as a plastic surgeon, I'm not a stranger to seeing patients that have lost a significant amount of weight. And, what I've always noticed is that patients that lose weight, especially patients that lose weight rapidly, have a tendency to also lose lean body mass and also that skin laxity that kind of comes in. And so, the addition of GLP-1 agonists has been another tool, has made weight loss more accessible to additional patients. So when I brought Emsculpt Neo on, I was finding that patients that I started on Emsculpt Neo at the initiation of their weight loss, I found them to have much better muscle mass and retaining of the lean body mass, and also the skin laxity, as Dr. Rappaport had pointed out, looks much less than what we see for somebody that's just losing weight. So I also see a lot of patients that present to the practice that are not quite ready for any body contouring procedures. So this is a lady that is a 48-year-old female, presented, clearly has a lot of visceral fat and also some skin laxity. And so, we partnered with a local clinic to prescribe some GLP-1s to give her some benefit for that weight loss. But also, I wanted to start her initially right away on Emsculpt Neo to help improve her I think can you hear me, Nick?
Yes, I can hear you.
All right,
You're
good.
doing great.
So, so we started her on Emsculpt Neo with both the abdomen and the flanks with her weight loss, and so we got her started with that, and so we planned 6 treatments of Emsculpt Neo as she was doing her weight loss. So, if you want to move to the next slide. And so this is her results after just the Emsculpt Neo and 30 pounds of weight loss. And I think you can see things that I did not see when we were just having patients lose weight. So she's got much less skin laxity than I would have imagined for somebody that lost the kind of weight that she lost. Also significant improvement in her visceral fat, but also see how narrow her torso is. So she's actually improved her rectus diastasis and gotten a flattening of the abdomen. You can move to the next slide.
That tissue looks great.
So then, she still is dealing with this infraumbilical midline C-section scar and some skin laxity that she was bothered by. So then we proceeded on to an abdominoplasty, and I find that the M-Sculpt Neo is a fantastic way to prejuvenate a patient before body contouring procedures. And you can even see, and I could not achieve this surgically, that 4-pack that she's got working in that upper abdomen post tummy tuck. And so tremendous benefit for her as a prejuvenation for her body contouring procedure. And you can see that flatness that she got with the M-Sculpt Neo. And then as we got rid of that extra skin and then finished out her rectus plication, how much flatter she got with the procedure. And this patient has done, much better than what we would see if somebody had just simply lost weight. And the tissues that I had to work with for the plication and surgery, were much more robust than I typically see. And I also find this M-Sculpt Neo to be really a benefit for patients that, as they're losing weight, they start to see a result in the area that is the last place to see a result. So it can be a very motivating factor in addition to maintaining that lean body mass so that their weight loss does not stall.
Yeah, I love the progression and how we can really tie this into the plastic surgery world at the same time, because some people, like what you just showed, they need it when they get to that point. So having this come from that perspective is great. I'm a big believer in, if I can control treating healthy tissue in any way, I'm going to err on that side. So we're going to talk about some protocols here in a minute. So this particular case study, and I want to make sure that we have some time left over for Q&A at the end. But this lady, she was 55 years old. And she came in, she actually saw my ad for M-Face. And I sit down and we're going through the entire consultation and start peeling apart the onion on what's going on, what she's really trying to accomplish, where she doesn't have her confidence anymore. And we ended up doing a combination of M-Face, M-Sculpt Neo on stomach, her flanks, and her glutes as well, simultaneously doing semaglutide. With this particular patient, we only did 2 months of semaglutide. We started really getting our hormones optimized at the same time. So this is a full comprehensive patient that we were able to bring in. I wanted to show some of the data that we got with this, because when you see some of the data points that we talked about earlier, of that up to 40 to 50% of the weight loss actually being muscle, if you're doing this appropriately, you can really minimize and negate a lot of that muscle loss if you're combining it with these technologies. And we use our InBody 570 to get this data points, but we are always really focused on health and looking at every objective data point that we can with all of our patients along the medical weight loss journey, the hormone journey, or M-Sculpt Neo as well. But as you can see, 42% fat reduction and 9% muscle loss. That is substantially different than what we are seeing nationwide. We've also seen some other patients, they did not sign away for me to do this, that have seen 0 muscle loss with over 25 pounds of fat loss at the same time. So if this is done appropriately, what we're talking about is real. You can negate most of the negative side effects in terms of the muscle wasting into this entire process. But a lot of people on this call also want to know, how are we incorporating this package? How does this work into the business side of things? Dr. Rappaport, could you kind of dive into how you're doing it at your clinic?
Sure. So our patients, if their insurance covers it, I prescribe either semaglutide as Ozempic, Wegovy, or we do tirzepatide as Mounjaro or Zepbound. If their insurance doesn't cover it, we have a compounding pharmacy here locally, and the cost for me for 1 month's supply of medication per patient is about $125 to $150, and we charge the patient $299 a month. So that would include 4 pre-filled syringes, and they would come pick it up once a month. We check in with them, make sure everything's going well, and then they would self-inject at home. There were a lot of questions that popped up about how to get approval for these drugs through insurance. So if the BMI is 37 and you have about if the BMI is 27 or above and you have a comorbid condition, so hypertension, diabetes, even fatty liver, some insurances will cover it. There's coupon cards available online for the patients, but the vast majority of people, the insurance just doesn't cover it. Their employers aren't adding it on as a benefit for them. So for those patients, we do it through a compounding pharmacy, and we do semaglutide. It's compounded with vitamin B12. So basically, when a patient comes in for consultation, some people can't afford a whole deluxe package with everything. Some people can just afford the $299 a month, and that is fine. And for those patients, I tell them just what we talked about, the importance of skeletal muscle mass and how important it is that they work out at the gym and they do resistance training, whether it's on Nautilus equipment, with a personal trainer, bands, there's stuff online, videos, but it's so important. And I stress it to them that they have to maintain their muscle mass. For the patients that can afford both the combination therapy, I like to go ahead and start them at the same time. So when we start semaglutide at the 0.25 milligrams, most of the time that's more or less to acclimate the gut. We're not seeing real significant weight loss the first month. And when we're talking about functional improvement, I usually treat with four Sculpt Neo sessions, and I'll either do the abs or the glutes depending on where I feel the patient needs the treatment most. So they're getting their once a week for 4 weeks, their Sculpt Neo, while the is getting acclimated to the medication. Then the Neo treatments stop, and then we bump up to 0.5 milligrams of semaglutide, and then we just kind of see how they do. If they're losing weight on 0.5, there's absolutely no reason, there's no data, there's nothing that's been published that says we have to keep ramping up the dose of the medication. And then Neo takes about 90 days to see the final results. So as they're also losing weight over those 90 days, we check in on them monthly, and we do our before and after pictures and our measurements, and we just kind of follow along and support them on their weight loss journey. And I have some people that just don't want to inject any medication. They're just very holistic, but they like the fact that Sculpt Neo is an energy-based therapy, and they come in and they, we treat whether it's 4, 6, or 8 sessions, again, spaced 1 week apart. So you can really tailor to your specific patient's needs a treatment plan.
Yeah. I love it.
I think that might answer. There were a lot of questions popping up on the side, so I hope I answered most of them.
Yeah, and I think some customization, which with each individual patient's needs, is key when you're doing a consult, right? I think part of the problem in this whole space is the cookie cutter operations that are out there, that it doesn't matter where you are or what you have going on. This is the plan. It's box A, box B, and good luck. And that's, in my opinion, not the way that we do it. Dr. Silva, could you please share with us kind of how you do your business model?
There is a little typo there. The starting price is $339 monthly, not weekly. It should be $339 monthly for the semaglutide injections, and then $50 monthly to every 0.25 milligrams of semaglutide that we add monthly. And like Dr. Rappaport, I'll have a lot of my patients on 0.25 or 0.5 milligrams of the semaglutide, and they do just fine. I don't have very many patients that take more than 1 milligram, but I'm looking at them from a functional point of view, because I am an integrative wellness doctor. Sometimes people don't do well with just semaglutide alone. You have to look at other modalities like hormone therapy treatment and what the diet that's going to work best for them, what exercise protocols that you're going to give them. It's really a project for each patient when they get into this weight loss journey. I do the initial weight loss consult. Sometimes for my hormone patients, I'll waive that fee. My weight loss labs are $95. I do labs on everyone because I come from a place of health. I am not a weight loss clinic. I am a medical doctor that helps people lose weight. So it's totally different. So I'm looking at them from a face of health. When they come in, I typically won't do Sculpt Neo if they are over 20, 30, 40 pounds overweight, because the results are underwhelming for them. So I will usually have them lose weight first and then start the Emsculpt Neo. M-Face is another, I would start that first on patients before the Emsculpt Neo, because it doesn't matter how much they weigh with the M-Face, or do the Emcella. We talked earlier about how the pelvic muscles can lead to incontinence when they become weaker. The Emcella doesn't matter how much you weigh as well. So I like patients to give them a customized, personalized treatment, and they feel special because they know that their package is not the same as anybody else's package, that I'm giving them personalized care. And they trust me because I've been a patient. I used M-Face, Emcella, Emsculpt Neo. I love, love, love combining Emcella with the Emsculpt Neo. And actually, I will sometimes give the Emcella for free. They buy Emsculpt Neo package, because remember, the Emcella does not have a there's not a cost for the doctors to do that. There's not a consumable. So they get that value sense that, wow, we're really helping their pelvic core muscles. We're helping their abdominal core muscles, and they're giving a kind of reboot to their body from literally from face to pelvic. And people like that. I see the transformations on people, and it's incredible. And I love when my favorite time to do the Emsculpt Neo is when they're about 20 pounds, close to their goal weight, because then it's phenomenal. And they're like, wow, this works. And then they want to do it. I have them do it like once a month or something, just to keep maintaining. I tell them that the weight loss is done in the kitchen and maintenance is done in the gym and with Emsculpt Neo, right? We keep the weight off with the Emsculpt Neo and the Emcella. And the Emcella has been transformational for men who never did Kegels. If you ask a man if they've ever done a Kegel, they don't even know what that is. But we know that Kegels will help increase our pelvic support. And so we can't underestimate the importance of making that stronger. So when men not only get results from the pelvic support in terms of incontinence, but also with sexual enhancement. And guys will tease me and say, why didn't you start off with that in the first place? I would have done that right away. But we have to understand that there's a lot of functional benefits that these machines have besides just aesthetic. And in my practice, because I'm an integrative functional doctor, I focus on the functional side of it, and it keeps the patients wanting to do the treatments for maintenance and just for overall better health.
I love this. And this is why we like to do these roundtables, is you're hearing different perspectives and how they approach it, because how we do things is a little bit different than what we heard from Dr. Rappaport and Dr. Silva, where if I can hit their abdominal muscles, we are starting them on semaglutide, or we're starting them on Emsculpt Neo immediately. So we will, in my opinion, if I can stop the muscle loss to begin with and not try and play catch up, I'm avoiding some functional issues. That's in my brain, right? So if we have a gentleman, which is, we treat a lot of men, and he comes in and he's 40, 50 pounds overweight, but it's all distended visceral fat, and I can hit his entire rectus and obliques with Emsculpt Neo, what we'll do is we'll actually start them simultaneously with the GLP-1 antagonist, but with Emsculpt Neo. We'll do 4 treatments, so once a week for 4 weeks. I will wait 6 weeks, do another treatment of 4, and you almost get a compounding effect. And like I said earlier, any chance that I can control treating healthy tissue, we want to do that. So we're basically going to have full new muscle mass after that initial 6 weeks. So then when I treat the core again, I'm treating all healthy abdominal tissue. So we're getting that big boost. And then we'll actually do 1 Emsculpt Neo treatment every other month, as long as they're on the medical weight loss journey that they're doing. So we're getting that permanent visceral fat loss, because a lot of the men that are coming in, and women, also have that visceral fat as well. But on average, I think the most recent data out of Canada was 17.5% permanent visceral fat destruction that's happening with 4 treatments of Neo. So we'll do that initial 4, wait 6 weeks, do another 4, and then maintain the muscle after that. So that's been kind of our protocol. In terms of what we're charging, we do different package pricing. And in the consultation, it's important that you don't overwhelm the patient. So I kind of separate it. So if I'm sitting down and doing an initial consultation with a patient, I want to definitely make sure we're addressing, hey, you might have some functional issues that are going on besides just wanting to lose weight based on some of your symptomology. I think it would be best for you to see our hormone optimization practitioner, medical, or our women's health practitioner, whatever it is. So when somebody comes in and they want to talk about Emsculpt Neo, kind of like the patient that you showed earlier, Dr. Rappaport, where they came in because they didn't look great. And I'm sure they were excited to talk about Emsculpt Neo or some of the technology, but she was a good fit for the medical weight loss.
Oh, she's done everything. She's done every BTL device in our office. She's the biggest fan. Yes.
Yes, exactly. So when they come in because they're excited about a device or they're excited about some of your advertising of the medical weight loss, what I will do is make sure that we talk about the function and the health piece first. So we'll see based on your symptomology, your fatigue, that's testosterone, thyroid, iron, ferritin, vitamin B12, mood changes, and break it all down. So we're having that functional hormone symptomology conversation along with the medical weight loss. So we'll say, hey, no matter what, I know you said you really need to lose 30, 40 pounds based on what you're telling me. Let's make sure you're a good candidate for that. Because obviously if their A1C is too low, if you throw them on something that's going to turn on insulin sensitivity again, and that's not their core root problem to begin with, then you're chasing your tail a little bit. So we need to make sure that you have the right candidates for this entire process. So I'll say, no matter what, we're going to collect $515 that covers full comprehensive cash-based hormone panel, medical weight loss panel, and fatigue panel. And we're going to give you a full hour with our women's health practitioner, obviously, if it's a woman. And then I'm going to talk about Emsculpt Neo. So the way that we do it in our business model is I don't want to overwhelm them with talking about all the things all the time. We need to address this. We need to make sure that you're a good candidate for this because their blood work can come back to where they're not going to be an ideal candidate for the medical weight loss, right? So we separate that, get payment for that. We know we need to lose 30 pounds, so that's already checked off. And if their hormones are clearly out of whack because of their symptomology, you have a patient for life, right? So I want to shoot for a patient for life and then talk about the sexy machine that gets everybody excited that's actually solving root problems. So the way that we do it in our business model is we separate it a little bit, even though the treatments are simultaneous. Because what I have found, if I talk about getting into the entire world, it can overwhelm some of the patients where, yes, we want to do the GLP-1. That's an easy conversation. You need to make sure they're a candidate to begin with. Then when you talk about Emsculpt Neo, permanent fat cell destruction, we're going to be strengthening 25% of your lean muscle mass. We're going to correct 20% of your diastasis recti. We're going to permanently destroy 30% of your subcutaneous fat. That's what gets the patients really excited about, but that's also where some of your margins are. So our package pricing is very in line with what we saw with both Dr. Rappaport and Dr. Silva. I hope that helps some people. And I think we left some time to jump into some Q&A. Somebody just put in the chat, my clinic is ariaintegrativehealth.com. If you want to see what we're doing, feel free to reach out to me. I am not a doctor. I'm a business owner. We pay the doctors to really sit down with the patients and break everything down. But let's have some good questions. I have a list here that really wanted to dive in on. So incorporating the BTL devices, the question that we got throughout the chat was, what's mostly financial benefit for your practice? I'm going to answer that quickly for everybody. Margins. If you're not paying attention to your margins, you're really missing the entire process of running a business, right? And don't get me wrong, GLP-1s are amazing, and they're truly changing and saving people's lives, right? Your margins are not going to be at the same place as what you're going to have with Emsculpt Neo, Emcella, like Dr. Silva said earlier. There's no consumable with that entire process. So making sure you're paying attention to what the patient wants, what's going to actually solve their core root problems with this, but also that. And I want to ask Dr. Eskra, because he's not doing the GLP-1s in his clinic right now. He's partnered, which I love, right? Staying in your lane. How have you seen your business model change a bit from having the conversations and collaborating with your colleagues around you?
Yeah, thanks, Nick. Yeah, I found that as the body contouring expert, I want to be the go-to place for that. So if I'm trying to, I feel like, do it GLP-1 and take away from some of the business that some of my local clinics have in their GLP-1 practice, I think that, potentially shoots me in the foot, as they will not likely refer their patients to me. So I actually partner with them. So I'm able to send them patients, and then they send me the body contouring patients. Symbiotic relationship. They know they can send their patients to our practice, and they know they'll be seeing those patients back. So I find that to be a really beneficial way to keep that in our practice. I think the barriers to entry to adding GLP-1s for a practice are not super high, but having the body contouring devices that BTL provides really differentiates our practice, and so kind of that partnership, I think, is really beneficial for us.
And one more question while we're talking to the surgeon is, some anesthesiologists have posted some concerns about having surgery with people that are on GLP-1s. Can you briefly discuss that conversation that you're having with your patients?
Sure. As Dr. Silva had mentioned, it slows gastric emptying, right? So we really want to stop those a minimum of 2 weeks before any surgical procedure to prevent aspiration and reflux risk that we can sometimes see with surgery. So, and usually at that point, patients are maintenance and really are oftentimes transitioning off of the GLP-1s, and so that usually isn't too big of a deal, but that's an important, very, very important consideration.
Yeah, that is, thank you for saying that. And then we had a question. One thing that popped up multiple times in the chat, so I'm going to address it right now. Emsculpt Neo is penetrating a depth of 7 centimeters. Emcella is 10 centimeters. So because of what we're actually able to do with this patented technology, so it's completely different than, there's zero competition out there to what these devices can do. So when we're treating a patient, if I can hit the muscle, I'm going to be able to thwart a lot of that muscle wasting in my brain space. That makes the most sense to me. So that's why we're combining it at the same time. But 7 centimeters and 10 centimeters for Emcella. And questions that were being asked, and I'll leave this to Dr. Rappaport and Dr. Silva. What labs are you really requiring going into the GLP-1 space? So if you have a patient come in, and what labs are core that you're drawing for just the medical weight loss patients, but then also what is more of a comprehensive to have one of those forever patients?
For me, for weight loss, I'm one, because I come from a place of health, right? One of the side effects, or the most common side effects, are nausea, vomiting, and diarrhea. So we look and we ask for kidney function, the creatinine, even though, and I explained this to patients, it doesn't cause kidney disease, but if you have the side effects, it can progresses to nausea, vomiting, and diarrhea, then it's not good if you have kidney compromise. There's actually been studies to show that it actually helps with nephropathy, with patients with nephropathy. But I get the electrolytes, right? The sodium, a regular chem panel. I like to follow their lipids, because you'll see that their lipids change drastically when they're on this diet, and they don't even have to take statins if they were, or they reduce their statins. And then I follow the hemoglobin A1C and the fasting glucose, because for myself personally, I had prediabetes and I had high blood pressure. I took semaglutide for 2 months and no more prediabetes and no more blood pressure medicine. So for me, I'm looking at all of the labs that we would look at for someone who has cardiovascular disease risk. So lipids, cholesterol. I like thyroid because it affects metabolism. diabetes panel, and the electrolytes. And then I'll do a CBC just because I want to make sure they're not anemic. But those are the labs that I will get initially and follow them based on what they need. But patients will trust you if you come from a place of health. If you're saying to them, listen, we're in this together, I want to partner with you, I want to make sure that this weight loss journey is healthy for you, then they trust you.
Yeah, absolutely.
I do the exact same lab workup, exactly the same thing. I don't have anything else to add.
We do the exact same thing in our clinic as well. Thank you for breaking that down so succinctly. Another question that was asked, how is Emsculpt Neo and HiFem really different from eStim and some of the electrical devices that are out there? Dr. Rappaport, do you want to dive into that, or I can handle that question as well?
I think it's just a whole different level of intensity. I think the contractions that you get with the HiFem magnet exceed what you can get with any of the other TENS type of units. I cringe when patients come in and we talk about it and they say, oh, is it like a TENS unit? And no, it's nothing like a TENS unit. And then they experience it because we do some demos in our office and they said, oh yeah, this is nothing like a TENS unit.
Yeah. And so we're with HiFem, we're able to penetrate so much deeper to affect the tissue, where eStim is actually a direct current. So you're only able to penetrate right around 1 centimeter, and you can't cause that full supramaximal muscle contraction like what Dr. Rappaport was doing or speaking about. But it's actually causing a full electromagnetic field as opposed to a very direct acute treatment that you have with eStim. Totally different animal from anything else that is out there. And I think we have time for one last question, and I'm actually really curious about this. Has anyone seen a 1 month DEXA scan actually get worse or better with a DEXA scan following a patient with a GLP-1? So are you seeing the tissue change, and with Emsculpt Neo, have you seen that plateau change and get better?
I will say that I have seen DEXA scans get better. It's not usually in 1 month though. It's usually a little bit longer time. And I think it's going to be multiple of factors. Because I'm an integrative wellness doctor, I make sure that they have hormone optimization as well, that they're taking certain supplements like Cal, magnesium, vitamin D with K. You know, it's a whole program. It's not just the GLP, but the GLP is very effective. I mean, it's been shown to reduce dementia risk, heart disease, liver disease. So that in combination with the supplements, with the nutrition changes, with hormone optimization, I've seen the DEXA scan, to surprise of many of my primary care counterparts, get better. Because with age, we don't really see DEXA scans get better. But I've actually seen that with better, but it's probably longer than a month for me.
Yeah, I mean, it makes sense that you would see those changes get better. And we want to definitely be respectful of everybody, all the amazing doctors. Thank you so much, Dr. Rappaport, Dr. Silva, Dr. Esker, Dr. Palm. Thank you. Thank you from me. Everybody that took time out of your day to join us. Hopefully this was very beneficial. I learned a lot. I love when we're able to really collaborate in this entire field and help, right? At the end of the day, rising tide lifts all ships. So if we can really help to guide you down what we're doing, and it might tweak and change your protocols for the better, or even on the business side, we would really like to do it. But if you are not having the conversation with your patients about the downsides of what's happening and being able to really treat that and counteract some of that, you're missing some of the point. We really want to help our patients at the end of the day, but I want to definitely say thank you to everybody that joined in. Thank you to everybody on the panel. We really appreciate you.
Thank you.
Thank you.
Thank you.
Thanks, Nick.
Absolutely.